Let's just get to the nub of Medicaid, okay? First of all, you know, one of the last Republican that I can think of who expanded Medicaid was Ronald Reagan. Okay, people tend to forget that. Here's what I'm faced with, and if other people don't want to take the money, that's up to them, but I got money I can bring home to Ohio. It's my money. There's no money in Washington. It's my money. It's the money of the people who live in my state. So what do we do with the money? We have 10,000 people sitting in our prisons who are mentally ill. First of all, we have more people sitting in prisons in America than we have psychiatric hospitals, people who are mentally ill. To me, that's immoral. That's a failure on our part. You know, we deinstitutionalized the mentally ill and promised we'd take care of them, and we've not done it. So my goal is to treat them, to get them on their feet, and to get them in a position of where they can work. Many people with mental illnesses can, if they're given the medication, if they're properly handled. And now in our communities, we now have the ability to treat the mentally ill. And you know, there are things that can happen with the mentally ill where they get themselves in deep trouble not even knowing what they're doing. That's number one. I don't want to put them in prison, have them come out, have them make another mistake, end up back in prison, cost $22,500 to be in prison, plus it's not the place for them to be. Let's take the drug addicted. You know, most of the people who are in the prisons around this country are people who have, you know, they committed other crimes, but they have substance problems, addiction problems. So what we are doing now is we're in the prisons actually giving them rehabilitation. And then we will release them into the community where they meet a community advocate, not a drug dealer standing on the corner. Now you know what the revolving door is. You go in, you come out, you go in, you come out. Now that isn't working. So we think our recidivism rate in treating drug addicted, if we're in there in an aggressive way and hooking them into the community, we think the recidivism rate for them would be 10%. That's worth doing. Take the working poor. Now the working poor without any health insurance end up in our emergency rooms. They end up sicker and more costly. Okay, I think it makes more sense to try to get them care so they can get the preventive care they need, and then remove the barriers for them to be able to climb up and have better work, because they are the working poor. Now, on all these programs, I want to kind of quote my mother, who used to say, "Johnny, it's a sin not to help those who need help, but it's equally a sin to continue to help people who need to learn how to help themselves." So we're now in the process of reforming this welfare system, which I talked about earlier. So this is not just we're going to give somebody something and that's the end of it. We're asking for personal responsibility for those folks. Some of them it takes a while to get to the baseline. Addiction is tough. Addiction is no longer with, you know, sort of quote, whatever the people think this is the population that does it. You know, now you see heroin deaths among kids that could have been born and raised and gone to high school at Chevy Chase. So this is an enormous problem in our country. So those resources are helping me to deal with it. Now maybe other people have other ways to deal with it, but that's what we're doing in Ohio. We're beginning to see a trend to emergency room visits by the poor at about the same rate as everybody else, which means that this is beginning to work. But you know, it also means that we have to have a robust job creating economy, and my goal is to get those people off.